So I'd like to introduce our first speaker in the interest of time, and so we won't waste her precious time. Our first speaker is Lori McFerrin, but what I would like to do prior to that is just share with you my particular passion in this issue. For some reason in my clinical career, before I started with the Maine Hospice Council, I had the privilege of working with many people who were living with and dealing with the challenges of ALS. And I live in the Mid-Coast area, and for some reason, there's a very high incidence of neurodegenerative diseases in the Mid-Coast area in Maine. And so I have many wonderful stories, as many of you do, and I won't go into them, but I will just say to you that it became a particular passion of mine as the Maine Hospice Council dealt with many underserved populations to highlight the population of folks that were dealing with neurodegenerative diseases. And there are many wonderful pieces of the evolution of our work, both with the Maine Hospice Council and with my work personally with people in Maine and elsewhere, that still today is so near and dear to my heart. And you will hear from many of those people who also have a great deal of passion in this issue. And years ago, what we decided to do was bring in the voices of patients and families to be faculty in a series of trainings that we did. It was highly popular and really resonated with providers. Oftentimes, as you know, we don't bring in the voices that we really need to be listening to. And when I was talking with Lori McFerrin about leading off this morning and sharing her professional experience and her personal passion about this topic, it was clear to me that there are, as it has been over many years, that this issue is near and dear to a lot of people's hearts. Any family that's been touched by ALS will appreciate the fact that healthcare professionals and others, friends, community members, allied healthcare professionals, are keenly interested in improving and enhancing their own knowledge about this issue. So you're not only going to hear from Lori McFerrin, who is the ALS Association Care Services Coordinator and has been since 2018. After Lori speaks for about an hour or so and takes questions and answers, we will take a break, probably 10-minute break, and then we will reconvene with a very engaging panel. And I'll introduce the panel members after the break. And so we'll begin right away without further ado with Lori McFerrin and her professional experience and her passion. Her background is varied. She brings to us a bachelor's degree in psychology and a master's in medical education leadership. Her passion, as she has explained it, is person-centered, person-directed care, which made me smile for sure. And I'm sure all of you made you smile when you heard it. As I say, she's been the ALS Association Care Services Coordinator since 2018. She connects families and does a lot of training. She connects families to services in the community. She connects families to providers. She trains staff within institutions and the community. So she does many things, as well as partner with the ALS Clinic. Many of you probably know Lori, and I hope you ask her some questions about her background and her work, but I will now turn it over to Lori to share with you her many years of interest and passion around this issue. So Lori, welcome. We're delighted to have you. I'm sure everyone's looking forward to hearing from you.
Excellent. Gosh, thank you. Thanks for a wonderful introduction, and thank you for having me here today. One of the things that Candace and I talked about when we talked about a presentation today was far less about a presentation, but more about a conversation. So I want to give you a little bit of background on what my role here within the state of Maine looks like. And then really, I want to connect with you folks, because just like approaching a family or an individual living with ALS, I want to take this conversation and help you with your personal interests or your personal questions. So for the little bit of background, I wanted to just share what my work with the ALS Association looks like. During my small presentation piece, if you have questions, please, and I'm going to ask others to help. If there's something important in the chat that's relevant, please just get my attention, raise your hand, hit the raise hand icon. This really is a conversation. So Candace asked me to address the group today collectively as people living with ALS, as professional caregivers, and of course as those family, loved ones, personal caregivers of someone living with ALS. And she said, if this were your only opportunity to meet with these folks, what is it that you would want to do with your time with them today? So of course, my immediate urge is to share every educational option, every link, every professional that I've crossed paths with that is passionate about ALS, and more importantly than that, about the people who are living with ALS. Instead, I'm going to step back, I'm going to take a deep breath, and if your videos were on, I would try and kind of read the room. What is it that people are seemingly needing from me today? If I were doing a home visit with a family personally impacted by ALS, that is exactly what I would do. Over the last year, when we've become pretty accustomed to having our face-to-face over Zoom, I'm doing the same thing. If I'm having a family meeting and it's on Zoom, I'm really trying to pay a lot of attention, not necessarily to the most vocal person on the call, but the person who personally is living with ALS. How engaged are they? Are they having difficulty speaking? Are they seemingly wanting to be here? Are they maybe here because, gosh, this is what the family asked them to do this Monday morning? So whether I am with people personally impacted by ALS, or if I am with, a home care agency that has asked me to come and speak, I'm going to try and read the room and see what the needs are. The reality about my role as a care services coordinator is that I don't know what each of you who's living with ALS needs. I do want to be sure that you have access to what you feel like you need. And that's true for providers and caregivers as well. I find my role to be very much educational in purpose, making sure that people have, that people know what they need to know. And then my time is spent helping them through various phases or stages of their journey with ALS and making sure they know each step of the way, yes, your options may change. These are what they might be. What are you most interested in? What is most consistent with your lifestyle? I do want to tell you briefly about a new program that we recently piloted. Because of my love for medical education, I built a curriculum for people newly diagnosed with ALS. The name of the program is called Beyond the ALS Diagnosis. When I say that it's for folks who have been newly diagnosed with ALS, that is with a bit of a caveat. The one prerequisite for the program is that any care services coordinator, so that would be my role, and within our chapter, we have a care services coordinator in Vermont. We have one in New Hampshire, and I'm the one in Maine. When we first piloted this program, just now 5 weeks ago, we invited Massachusetts as well. So we asked that each care services coordinator do a referral for people they felt like were, fairly newly diagnosed, but were ready for a practical approach. I would imagine, and in my experiences, not people who are just diagnosed with ALS are not ready to take a practical approach. And what I mean by practical is, how do we take this enormous topic, condition, and multiple aspects of not only what someone might experience living with ALS, but what they might need, and what are the treatment options, and where do they get all of these things? But there's the emotional aspect. And I was very careful to ask my peer coordinators to just do a little bit of explanation of what we were doing. And excuse my my phone message. I've got one of the old-fashioned phone machines, so forgive me for that. And so, as I was saying, what I asked of my fellow care coordinators is to just have a conversation with people who were fairly newly diagnosed with ALS to see if they really were ready to have a practical kind of instructional approach to, if you think of it in kind of layman terms, what do I need to know about living with this disease? And so that meant that we wanted to make sure that people were far enough along in their acceptance of the grief that comes with an ALS diagnosis. And so we had 11 folks who started with us. Many of them had a loved one with them. And most of the folks in our pilot program were diagnosed the end of last year, maybe one or two at the beginning of this year. So you figure they had a good 4 or 5, sometimes 6 months of digesting the idea of an ALS diagnosis. Still working through grief, yes, but they, with their care coordinator, felt like they were ready to take on this program. And so what I want for you to know about the program is that it was, the curriculum was designed with very specific learning objectives. And so let me just find my notes. So the learning objectives were that we wanted to identify 4 areas of consideration to look at with an ALS diagnosis. We also wanted to help people understand resources and how to build their own village or their community. And then also one very clear objective for the curriculum was to help individuals take action. What are their individual next steps? So in week 1, we covered the first 2 considerations, physical health and emotional health. We laid out some specific thoughts about what symptoms might look like and what actions you might choose to take with those physical health considerations. And a reminder throughout the program was that deciding to take no action is action as well. That is one of your options. And then the second topic, or second consideration in week 1, was emotional health. And that meant laying out some of the emotional considerations that someone may have, specifically with an ALS diagnosis, but with any diagnosis of such gravity. And at the beginning of each week's program and at the end, we would just kind of check in with folks. And I had to give some serious thought to, if we're going to leave week 1 on the topic of emotional health, how do we wrap that up in a way that people are feeling okay about that? And did they want any follow-up specific to emotional health considerations? Week 2, we rolled into the last 2 areas of consideration, insurance and financial considerations. And then the final one was ALS education, trials, and research. So 4 very kind of concrete areas that we were delving into. What I should have said is that we did this virtually. We were not able to meet in person, but it did allow for people from 4 states to be able to join us. And we met every Wednesday morning for 4 weeks, same time, so that we could just set aside that specifically as from the association perspective, making sure that we were all committed to giving the time to that program needed, but also for participant ease and that having it at the same time. And we were very careful with start time and end time so that folks, you know, could get on with the rest of their day. And then week 4 was dedicated specifically to taking action. And as we rolled from week to week, we as the coordinators or the leaders of the facilitators of the program would remind folks, we can take time for questions now, but know that week 4 really is about you having made notes about your personal priorities and determining which steps are next. And so a couple of things that I would want for you to know about that program is when we started in week 1, people came to the group and so many of them said, I'm here because ALS feels so isolating. And I want to know how other people are living with this disease. I want to know how others are getting their care. I'm not ready to join. I think consistently they felt like they were not, most were not ready to start joining a support group, but instead were very interested in meeting others who were in a like position, you know, similarly new in their diagnosis, even if their symptoms were not at all the same. So during week 1, people were pretty honest, but as we would expect, new to the group, so we're not overly interactive. Week 2, you could see the rapport building. You could certainly see some sharing of tips and tricks. You know, some people would pull a piece of equipment out to show somebody else who maybe had similar symptoms. And I'll share with you that by week 4, when we had said, this is your opportunity, I want you to take your personal priorities list and I want for you to interact with each other around what you think your next steps might be. And week 4 was probably the most, I don't know, the most beautiful group I have ever been a part of. These 4 strangers, they didn't know each other, excuse me, these 11 strangers 4 weeks ago who came because they didn't want to feel as isolated as they were feeling, came on week 4 and they shared and they told personal stories and they told of their experiences and they laughed quite a bit. They cried together. They shared their silver linings and what they're looking forward to and how they're going to get that. They talked about the reality of an ALS diagnosis, but they talked about the gifts that diagnosis has brought them just in 4 and 5 and 6 months. So as far as a pilot program goes, I haven't seen all of the responses to our surveys, but I feel like we are off on a good note. I feel like we're hitting a lot of the objectives we set out to hit. And I think that it's a program that, and it will continue to be offered over Northern New England with a relative routine, on a routine basis, just so that we can be sure that we're kind of catching people at that point that they're ready to determine some next steps, and yet have had time to grieve that initial sense of what an ALS diagnosis might mean. So some of what I want to say to you is what I would say to anyone who's learning about ALS because they need to on a personal note or a professional note is, I want for you to have what you need for education, for resources, for equipment. But I don't want to rush in and try to tell you what you need. This is your life. You will want to know what you need to know to make decisions on a timeline that works for you. I'm not going anywhere. The ALS Association isn't going there. The world of ALS support is growing, thankfully. You know, Candace talks about her personal investment in ALS care, and she knows that 4 years ago, there was not an ALS specific clinic in the state of Maine, that there were not things like platform trials for medications that not only maybe treat ALS, but will find a cure for ALS. So I want people to understand that there is hope in this fight against ALS. I still would want people living with ALS to get everything that they need, whether it's equipment or emotional support, for their family members to get what they need, because this is their reality and they're living with ALS, which is still a terminal disease. But for those caregivers, those care providers, those professionals who have known of ALS for many years, I want for you to see that there is great growth out there. And the more awareness of ALS that we provide, the more education we give around real therapeutic interventions for ALS. And that's important. I want to just say that again, that just knowing of ALS and knowing that it is a fatal disease is not enough for providers to know. Providers need to know all that is available for our folks living with ALS as far as therapeutic interventions. And I and our clinic team are always available to do trainings, to do family caregiver trainings, and to provide professionals with whatever is needed to help them treat their people living with ALS. So again, back to what I want for you to know, if this is the only time that I get to spend with you, is that the ALS Association is an incredible resource, even for if you connect with ALS.org, they can help you find local providers. So if it's here in Maine you're looking for, the ALS.org site will connect you with Northern New England chapter, and the Northern New England chapter will connect you with myself and with our main clinic. But if you have a loved one in Colorado, ALS.org, and they'll connect you with the Rocky Mountain chapter and care services folks there. There really is no reason why folks with an ALS diagnosis cannot get support, no matter where they are in our country. But this isn't our only meeting. And so connect with me if I can help you on a personal level, if I can connect with you and your organization to provide training, to remind therapists and nurses and personal care aides of some great approaches with folks living with ALS. I share with families and with organizations regularly. We cannot expect our home care agencies and hospice agencies to know everything about every condition. So let me help when you've got ALS folks. Let me help your staff your patients and their families by offering a perspective and another voice to the conversation. And I'm really wanting to open this up to questions. I would like the rest of our time to be question and answer. And so Paul has just asked a question about what is the incidence of ALS in Maine? And I really can only answer that in a way that I can tell you how many people I'm working with at any given time, because right now we don't have, ALS is not a reportable disease, so the Maine CDC is not collecting that data. I can share with you that I typically have about 70 to 75 folks on my active caseload at any given time. I know that that is that's significant. I don't know if it's significantly less. It's less than what is out there for patients living with ALS in Maine, because I very much track where our Mainers are, or the Mainers that I'm working with are, and I know that they're very underserved in the areas where there isn't good neurology coverage. I work with only a few people in the Aroostook County area in the western part of the state. And if you take a look at neurology services, you'll see that they are lacking. And Washington County, Aroostook County, and then down in the more rural areas of the state. Somebody has, and so I'm just reading some of the chat. Somebody has asked for a brief description of ALS, and I'm very happy to do that. I'll try not to take up too much time on that because it varies so significantly. So ALS, the onset of ALS can come in a variety of different ways, and I'll explain that there are two different types of onset of ALS, meaning that folks might see it in their limbs first. So it could be that one hand has weakness, or that a leg has weakness, or somebody might notice that their foot isn't staying up. It's called drop foot, and they're kind of tripping on their own toes. And John has a question. So John, I'm seeing you, and I will come back to that. So the two types of onset of ALS are limb onset, meaning that there are changes, weakening in limbs. The other onset is what's called bulbar onset, and so that's talking about this area of the body. And so some folks may notice slurring of their words first, or weakness in getting their breath, or choking. And so bulbar symptoms are all of those things. The muscles in the mouth and the throat and diaphragm area are weakening, and so that's where you're seeing the symptoms first. ALS is progressive, and so where you're seeing it is likely to get weaker. So if it's in your feet or your one foot, you're likely to get progressive weakness in that leg, possibly both, possibly your limbs. I know it's frustrating for people to hear, but there are no two cases of ALS that look the same. So some people who get bulbar onset, who maybe are losing their ability to swallow, are wondering, well, gosh, am I going to need a wheelchair at some point? And there's no easy answer to that. We help people understand what different symptoms look like and what interventions could be helpful. But when someone has symptoms here, we aren't pushing them into a wheelchair. That just doesn't make any sense. What we are doing is making sure if their symptoms are here, we're making sure they have really good education and support around safe swallow or alternate nutrition things. For instance, people with bulbar onset ALS might have a feeding tube. And for some people that seems drastic, but if the rest of your body is acting healthy and your brain is healthy, what do you need? You need ongoing nutrition. And so if you can't get it safely through swallowing, then a feeding tube is so common now as a living well approach, as opposed to an end of life concept. The other thing is there's really good respiratory support that people may use, some good support at night, not because they're needing the oxygen so much as they're needing the help to pull off the CO2. So that's a lot of information, but I just wanted you to know that it's not just in the limbs, that there are some people who have some still strong limbs, but their symptoms are here. I'm going to take a look at the chat. Let's see. All right, Julie, I'm a chaplain at the Richmond, Virginia Hospital in Virginia. Where can I go to get a better idea of the various emotions experienced by ALS patients, caregivers, and family members so I can better support them? Julie, one of the first places that you could go is, when I said there's a lot of great resources at als.org. There are some, and I'm looking around my office because I have a bunch. There are some booklets that are free that you can order. They're called, let's see, Living with ALS resource booklets. And there are some on physical symptoms. There are some on, or symptom management, but there are some specific to changes in emotion when living with ALS. So als.org, and then the Living with ALS resource guides are very, very, very helpful. I wonder if we're able to unmute John. John's been very patient and has a question.
Catherine?
I'm working on it.
Maybe I'm unmuted now?
Yes.
Okay. I had an amazing experience with an ALS patient, but hospice would only get involved at the very end stages.
Mm-hmm.
By the time I got involved, he couldn't talk. He was on breathing tube. He was on feeding tube, but we communicated through a computer.
Mm-hmm.
He was a veteran. They had retrofitted his house so he could get himself in and out of bed into the bathroom. They had a handicap van for him to get around in. Would that sort of support be available to everybody, as far as retrofitting your house and hospital beds and handicap vans, or only because he was VA?
John, mostly because he was a veteran. Veterans are at least twice as likely to develop ALS as the general population. And so now the VA sees an ALS diagnosis as 100% covered. And so John is right in that the veterans take incredible care of their veterans who have developed ALS. And if people are working with a veteran and they're not sure how to best connect them, I will guide you that it is the PVA, the Paralyzed Veterans Administration, that helps our veterans. And I have the contact information if you need that. The Veterans Administration is a huge conglomerate, as we know. And so I like to try and streamline that so folks know exactly where to go to get that. John's right. If there is equipment that is needed, if there are home modifications, they have a set amount, but the veterans are wonderfully generous with the Veterans Administration are wonderfully generous with their veterans. John, I and others within our ALS community spend a lot of time trying to help people get connected with what they need. And so it might be that it's equipment from our equipment loan program. It might be that it is grant money that we access through any foundations and grant opportunities that we are aware of. In Maine, we have the availability to access Jill, the architect at Alpha One, whose role is to help people make recommendations for people to make changes within their home. There are not specific funds available for that, but there are a couple of grants that people access. The other thing is that in this day and age, a lot of people are doing GoFundMe and are getting help from their village specific to a wheelchair van or a ramp or a bathroom remodel. So as a community, I think we're doing a pretty good job in just wrapping resources around folks, but we will never be able to compete with what the Veterans Administration is doing with veterans.
And of course, in hospice, we're only involved in the last stages of it. So, you know, we can't be helpful in getting people comfortable with living with ALS. We're getting them comfortable dying with ALS.
And I think that if the conversation is, if it's a good open conversation, then I like to see folks living with ALS choose hospice. If they're not involved in trials and they have what they need for good care, then I'd like to see people working with hospice sooner rather than later, so that it really is about living.
But they have to be certified by their physician that
Right.
probably they only have 6 months to go. And so that factor. But thank you.
Yeah, no, great questions. Thank you.
Lori,
yes.
Lori, could I jump in here? This is Candace.
Yeah.
In regard to John's comment. John, you bring up an interesting issue, and there's a difference between the philosophy of hospice, which is no matter how long anyone has to live before they actually die, hospice philosophy, of course, is about helping people live until they take their last breath. Sometimes what comes in the way of a formal engagement of staff with hospice families is the reimbursement system. And so I think I just always want to make clear that those of us who've been in the field for years and years and years want people to understand that hospice used to be an all-volunteer effort. And I remember back in the day doing clinical work when I spent 3 years with a family who was, their daughter, who was 28, was living with ALS. So today, the restrictions, the regulations that have come into the picture have put some restraints on the amount of time that staff can spend with families. So I just want people to know that it's not because of lack of interest on the part of staff and volunteers with Medicare certified programs. It's just the parameters of the structure of the programming. But I think most programs do turn themselves inside out to get their volunteers to spend time with those families. And we have some folks on the phone from all volunteer hospice programs, which, as Lori knows, step in and do their work free of charge. So I just want people to understand the nuances of hospice. Yeah.
Thank you. Really nice point.
So are we allowed to make a remark? This is Barbara Barnett. Are we allowed at this point to join in?
Oh, yes, absolutely. I would like to just get back to, I think Leslie and Paul have a couple of questions. So I want to get to those. And then Barbara, yes, I think we've got a bit more time. So we'll get to your questions next. So Leslie writes in follow up to Julie's question, how can hospice volunteers better serve clients who have ALS? Are there issues we can be prepared for that are common but unique to ALS patients at the end of their life? And Leslie, I think I think understanding your patient is going to be best. So if the patient can express to you what's important to them, if they're unable to express what is important to them verbally, then as John had said, some people with ALS are using different communication devices. What I would hope for everyone, either living with or working with someone with ALS, is to have a very basic communication support. And gosh, I should have brought some props to show you, but so for some people, that might mean that somebody uses a communication device and they're typing, or they're using eye gaze to type things out and the computer will talk for them. But if suddenly they're in the bathroom and the eye gaze machine is in the other room, we still want for them to be able to express their very basic needs. So it might be that we have signs on the board, yes on this wall, no here, or, water, or whatever some of the basic needs are, or the blank twice for yes. So think about when you're working with someone, even if they don't need it all the time, to have a very basic way to express basic needs. So basic communication, I think, is important. Understanding people with ALS might have different devices, breathing apparatus, even if they're not on a vent. There are, a good number of folks are using non-invasive ventilation, sometimes just at night, sometimes most of the time, and to understand what that equipment is doing so that as a volunteer, you are less intimidated by it. And then just understanding the person. I recently did a visit to bring some equipment to someone, and so I ended up spending my time with the patient's wife, because a hospice volunteer was in reading old war stories, and the gentleman living with ALS and his male volunteer were in there having a great time, because they both had a shared interest in the story that was being read was of interest to the person living with ALS. So I would just say, get what you need as a volunteer, get what you need to feel comfortable helping your patient, and I think you're going to do great. Hopefully that answers your question. And then Barbara, I know that you had wanted to bring something up.
I would just like to mention that in Washington County, we are not under the Medicare umbrella. Our hospice organization, Downey's Hospice Volunteers, is a standalone volunteer hospice. So we can get in earlier than the 6-month diagnosis. We have had several ALS patients over the last few years. It would have been nicer to get in sooner, but unfortunately, like you mentioned, they're often not quite ready. And they have been all ages, from 24 up to older patients. That was all. I just wanted to make sure that the all standalone volunteer hospices can get in earlier, because we're not tied to the 6-month diagnosis.
That's so important, and I'll share with you. I mean, I want for Barbara, you and your team to know that I got some wonderful feedback from the hospice services in Washington County. Really great stuff going on up there.
Nice to know.
So I'm interested to know if there are other questions. I don't see anything more in the chat.
Lori, there was a question earlier. Someone was speaking about the incidence and wanted to know a little bit more about the detail of incidence of ALS in this country. How rare is it, or how How prevalent is it? Could you speak to that, my dear?
Gosh, I know that, I'm not going to get the stats right. I know that there are so many per 100,000, and I don't remember off the top of my head what they are. I will, to go back a little bit to, where is ALS coming from? There's a lot we don't know about where ALS comes from. Only about 10% of our cases of ALS are genetic, are familial. Otherwise, they're 90% we just can't pinpoint where it's coming from. And so I'll share with you that over recent years, there has been lots and lots of research and data collected as to where have people lived. Candace mentioned, why is there this incidence in the mid-coast area? Research being done in Vermont and New Hampshire has looked at some of the lakes area. But then, we talked about our veterans and why is it our veterans are so much at so much higher risk for ALS. And, I've had veterans say things to me like, well, gosh, was it the chemicals? Was it, when I was 25, they lined me up and gave me 16 immunizations all at the same time. Was it the stress I was under? And we still don't have the answers to that. So I'm sorry that I don't have more data for you on where or why.
Lori, there's also, I presume you work with the ALS clinic at Togus. Do you? Yeah.
I don't work directly with them like I do with the ALS clinic in Brunswick. So I try and stay connected with, first of all, I work with any provider who wants some support and wants me to help with their cases. But I stay involved with the social worker to make sure that if veterans are being referred and I get their permission, I make sure she's got their name and is watching for them. And so I help in any way that I can. But the ALS clinic in Brunswick, I get to go there and participate in their clinic. And so I am part of the rotation of who people see that day. I'm not that lucky to be able to do that with the veterans, however.
Mm-hmm, mm-hmm. I'd just like to give everybody the name of a woman I worked with at the VA who is a coordinator of the palliative care and hospice program there, and her name is Pam Brown, in case folks need a name and a contact at Togus. So I'd be glad to send anybody Pam's contact information as well. So. And then she could refer them on to the ALS clinic at Togus.
Yeah, absolutely. And one other important thing to know is that when people living with ALS are choosing their providers, there is no limit, meaning that we have veterans who are getting a good overview of care at Togus, and yet they might come to the ALS clinic for the PT, the OT, the neurologists, who are all very focused on ALS specific, whereas the Veterans Administration is looking at all kind of paralyzed veterans and motor neuron conditions. They also appreciate having those two sets of eyes per se. Hopefully that makes sense. And then Dick writes, do all ALS patients eventually have all the symptoms? That is, are their limbs, swallowing, breathing, speaking affected? And Dick, there's no easy answer for that. That it's just too hard to know. And so when I said earlier that I and clinic teams try to help folks along the way so that they are prepared for changes and knowing what the options are for you if you're seeing these physical changes. I think I think the approach of kind of getting a baseline, understanding if you're seeing some symptoms in your limbs. I think that there's great benefit to getting a baseline of what are your breathing function tests looking like. You know, seeing a speech therapist and understanding, are they noticing any weakness in my swallow or my speech, so that you have something to compare it to. And people go to clinics, let's say every 3 to 6 months, depending on how rapid the progression is. And if you have those baselines, then you're getting kind of reevaluated every 3 to 6 months holistically. You know, are you losing some weight? Are there some conversations we should have about supplementing your nutrition? What are your breathing function tests looking like? Are there some interventions that would be beneficial? Because again, it's about giving you all your options so you can choose what's best. And what I mean by that is, if you are losing a little bit of weight and your breathing is weakening, are there things that we can do to supplement your nutrition and help you with your breathing so that your body overall isn't working overtime on nutrition and breathing, and then you don't have energy for the things that really matter? So it's an ongoing conversation and it's an ongoing assessment. There's a very common tool that really all ALS providers and clinics will use, and it's the ALS FRS, function rating scale. So it's an ALS function rating scale. And it's a holistic look at what are your breathing scores looking like, what are your writing ability, your eating ability, your walking, your steps. It's an overall picture. And so the scale is done. Let's say you go to clinic every 3 months. The scale is done every 3 months. And if the scale drops a little bit, a good clinic team is looking at, okay, where are the drops? And is there anything that we can do to change that? So a really basic example is someone dropped in their score because they're no longer able to do steps by themselves. Well, if somebody's needing more help doing stairs, then maybe we try to eliminate stairs from their daily activity. Because if they're needing more help with stairs, it means their body is working very hard at those stairs. And so working really hard means depleting your body of energy and burning up calories. So we still want you to get to where you want to go, but maybe we can make it easier. No, that doesn't exactly answer Dick's question.
Hi, this is Sharon White. I have a question.
Yeah, Sharon, love to hear from you.
Thank you. I am a volunteer. I was fortunate once to have a very nice lady who is an ALS patient in hospice. She actually had lost everything but her voice. But that was a wonderful thing for her to have. And she had a hugely supportive family and a circle of friends. But unfortunately, the staff in the facility where she was were kind of impatient with her because they had to do everything. And it was a tough thing to watch. And I finally did, talk to the volunteer coordinators, and, they got in touch with the people there and all that kind of stuff. But I was just curious if that's something that you have to educate often, the staff of facilities.
When I get invited to do that, I jump at those opportunities. And again, I've done those in person, and more recently I've done them over Zoom. And I really like to see an interdisciplinary group of providers. So definitely the personal care attendants, the nurses, but I like to see activity staff come as well. Because, and I really hope that my approach most of the time is not, I have the knowledge that you need, but instead together we have some of the answers. And so I have worked with some some facilities who really have struggled. I mean, all caregivers will struggle at some point. When you love your person incredibly, it's still a hard job. It's a hard condition to live with, and it's hard sometimes to express what your needs are. And so just like I would do with a personal family caregiver, I ask folks to be patient, but also to use the tools that the patient has given them. One of the folks that I work with who lives in a facility has actually taken the time to put up notes because she knows that her staff will change. You know, it's not always the same nurse and things, and sometimes you get a new nurse. And so she has some devices that some nurses don't know how to use or don't know her settings. And so she has some notes. And so she just tries to get their attention to say, you know, because she can't verbalize, but please read this. This will tell you exactly what I need. And if you take the time to read this, you'll be able to set the machine up for me. It'll take you far less time. It'll be far less frustrating. So we definitely want to use the tools that the patient is giving us, and then look to the interdisciplinary team to try to find approaches that are less frustrating and far more satisfactory for all of us.
Lori, I think the panel members who are family and friends will also help provide nuances to that response as well from a very, very, very personal place. So yeah, and I think they will highlight the frustrations many of them dealt with in trying to get people who really were knowledgeable and comfortable handling some of these symptoms. So yeah. It's an issue.
Yeah.
Mm.
Well, I think Catherine's letting me know that I'm out of time, but I can't thank you enough for having me. And I'm going to stick around for all of it. Okay.
That's wonderful, Lori. Thank you so much. I'm sure your work with the ALS team has been and will continue to be incredibly valuable, and you'll be a wonderful resource for people who just didn't even know you before now. So
I hope so. Yeah.
there you go. Yeah. So glad you can stay with us, and glad you can listen to the panel. Their richness will contribute in a very, very lovely way to your presentations or your conversation, in your words. Thank you very much. Yeah.
Thank you.
Thanks for your good work. Anyone have any questions before we go to break? A lot of people in the chat have thanked you for your presentation, so that's wonderful. Any further follow-up needed right this minute that folks don't want to walk away with feeling a little bit dissatisfied with as far as the extent of the conversation around one of their questions? I'm sure Lori would be glad to expound on it.
Candace, this is Barbara Barnett. Lori,
Sure.
I would like to thank you because I have not been able to get my chat room to work.
Oh.
And I get on the list. So thank you so much. And you might be hearing from me.
Wonderful.
Anytime, Barbara.
Lovely. All right. With that said, and again, a big thanks to Lori, and glad you can stay with us. We will take a break. You can all get up and get away from your screens and do whatever it is that's going to nourish you until we reconvene in about 15 minutes. So we'll see you all back on Zoom approximately 15 minutes from now. Let's just say maybe quarter past 10. And then I will introduce the panel members, and we will have a very, very rich and robust conversation with them. They have a lot to contribute from real world experience and sharing very, very personal stories about those they love. So thank you, everyone. We'll see you back here in about 15 minutes. Welcome back, everyone. Again, a special thank you to Lori for devoting so much of her time to us this morning. It was a great experience, and we're so pleased she can stay with us to hear this wonderful panel. People that I have known for many, many years, and am just so pleased that they also were willing to commit their time to joining us this morning, to sharing some very, very, very personal experiences living with folks who themselves were living with ALS. As we know, so many illnesses are family illnesses, right? And family can mean whatever your support network is, whoever gives you the support to keep on going, to have quality in your life, to make sure your symptoms are managed. And a lot of the questions that were asked this morning, I think, will be highlighted in their comments. I'm not going to take a lot of time. Their CVs are very impressive, and I could spend an hour just talking about all the good work that they've done. But I just want to make sure that we highlight the voices of family members and friends. Two of these people are direct family members, but as we say, family can be whomever is in one's support network. And so we have Corey Gardner with us. Her sister Caroline was ill with ALS. We have Rebecca Wyke with us, whose husband Joe Mayo was living with ALS and did live with ALS for 3 years approximately. And we have such a close friend of Joe's and Becky's family, Rita Melende, who worked with Joe and became a very close friend of the family, who took Joe to work every day. So I'm going to introduce each of these people individually, and then you can ask them any questions about their background, but I am not going to belabor it. Again, their resumes are very impressive. I will speak more to the personal side of things. So we'll start with Corey Gardner. And Corey's sister Caroline, who died in 2005, she lived through multiple diagnoses before she was diagnosed with ALS. And we know that happens sometimes. Sometimes other issues, other illnesses need to be ruled out. Nobody wants to think right away that somebody is living with ALS and wants to make sure that they have ruled everything out first before they diagnose someone with ALS. Because it's not a diagnosis that brings a smile to most people's faces, for sure. So we need to keep that in mind. Caroline, Corey's sister, was the one that got Corey involved in ALS causes in Maine. And that's where I met both of them at a support group, which you'll hear more about. Corey then went on to be very instrumental in the ALS Collaborative, which the Maine Hospice Council was also involved in at the get-go with TOGAS, the Veterans Administration Healthcare Center here in Maine. And it was a community effort, but Corey and Rita and others brought to the attention of the public that more and more needed to be done to bring this issue to the attention of healthcare providers, to institutions and organizations, so more could be done in the way of resources for these patients and families. Corey did a lot of work with fundraising. She was involved with the Defeat ALS Walk in Portland, and then the ALS Collaborative did such things as fund small projects around the house and improvements that needed to be made to accommodate folks with ALS, and was really instrumental in working with Boston hospitals to try to get an ALS clinic and to provide some telehealth access for families with ALS. So, and the list goes on and on and on. And now, of course, we have an ALS clinic here in Brunswick, and there's one at Togus, which you've heard about this morning. So lots of things have been done, but as with many things, it's a slow, methodical process, and it's driven by people that have lived experience. So thank you, Corey, for being with us. I'll now introduce Becky Wyke. Dr. Rebecca Wyke is the president of the University of Maine at Augusta. Becky has been involved with state government so many things in regard to finance. She was the vice chancellor for finance administration with the University of Maine system. She served in Governor Baldacci's cabinet and with the administration of 3 Maine secretaries of state. But I know Becky because of her husband, Joe. Becky and I met over the phone, I think, if I remember the first time I met her. I had heard her husband had been diagnosed with ALS, and he was the clerk emeritus of the House of Representatives at the time. And I remember walking up to him in the parking lot. I didn't know Joe very well, but I walked up to him and I said, anytime, I know how well connected your family is to resources and people, but any time that our office, and myself in particular, can offer you any support, just give me a call. And not too long after that, Joe's wife, Becky, gave me a call, and she will be sharing so much about Joe and the 3 years that the family was living with ALS. And Rita Melende was the lady who worked with Joe in the legislature, one of his seatmates initially, and then she served in Rockland 6 terms in the House. And then she worked with Joe as his assistant in the speaker, in the clerk's office. So Rita has many years, or had many years experience with Joe, both personally and professionally, while she was at the State House. And then what she did is when Joe was diagnosed, Rita gave up her seat and she took Joe to work every day, or as often as Joe wanted to go to work at the State House, which I think was pretty much every day. Rita will share a bit more about that. And before Joe died, they coordinated and organized the first support group for ALS in Maine. So you'll hear more about that. Rita's CV goes on as well, but I will not belabor this anymore. I will just turn the floor and the screen over to these 3 lovely people that I can't thank enough for joining us this morning. I'm sure you will all gain incredible insight in listening to their reflections. So thank you very much. And why don't we start in the order that I introduced them. We'll start with Corey.
Good morning, everybody. I've been listening with great interest to Lori's talk. I guess I have a few reflections that are a little bit more specific and reflect some of the learning that we had as my sister progressed through her journey with ALS. And one is the importance of a support group. When Carolyn was first diagnosed, she didn't want to go to the support group. She said, I don't want to be involved in any pity party. She didn't have any interest in doing that. But eventually she was prevailed upon to go to the support group, and it became very, very helpful for her over the course of a couple of years, getting tips from other people, getting information. There was tremendous information about treatments and clinical trials and so on, and a lot of just camaraderie really between the folks that were in the support group. And that was really very, very helpful for her. She did travel to Massachusetts for her clinical treatments because there was no clinic in Maine. Caroline was diagnosed in about 1999, and she died in 2005, and there was no clinic in Maine. She went to the Leahy Clinic. That was very good at the beginning, but it became exhausting. The 3-hour drive to Massachusetts each way basically put her in bed for a couple of days afterwards because it was so exhausting just to ride in the car for such a long time. So, but the clinic support was very, very important. And it was really, she got me involved with this because she wanted to see if there was a way to get a clinic in Maine. And it took us a long time, but now there is a clinic in Maine, which will make a huge difference for ALS patients in Maine. One of the interesting issues that she dealt with was communications. First of all, as soon as she was in a wheelchair, it made her crazy. She found herself, people would talk to her loudly and slowly as if she didn't understand what was happening. And it made her absolutely crazy. She was a lawyer, and she didn't have any problems with understanding what other people were saying. There are some cognitive effects of ALS. So she would sometimes laugh or cry sort of inappropriately, but that is fairly common with ALS. But the rest of her intellectual capability was unchanged, and she kind of went slightly crazy when people would talk to her as if she was a small child or somehow mentally diminished. So for those of you who deal with ALS patients in hospice and so on, that's something to be aware of, because it turns out it's very hard to talk to somebody who can't respond to you. You feel like you're just having a monologue, and we're all trained to sort of not do that, to have a give and take with people, and that becomes rather hard. She was using an eye gaze system. Eventually, she had a reflective dot on her forehead, and she could slowly type out things on the computer. And that worked well, but it was very slow. So you had to slow down the actual physical acts of communicating, but not the mental communication. And that turns out to be fairly difficult to do. But it was one of the key things that was difficult for Caroline. We talked a little bit about accommodations, and there's a lot of information that people get about ramps and bathroom remodeling and so on, and we did all of that with Caroline. One thing that was really huge for Caroline, like a lot of people in Maine, she liked to be outdoors. And once she couldn't swat at mosquitoes or brush a fly off her face, being outdoors was terrible. And so one of the best accommodations that we were able to make was to build on a screened-in porch onto the front of her house, so that she could sit outside, feel the sun and the wind, and not be bothered by bugs that she couldn't do anything about. So that was really really key. Her husband was a terrific supporter, caregiver, 24/7. caregiver, and he did everything for Caroline. He left his job and was with her basically every minute for several years there. And one of the things that we learned was the importance of trying to figure out how to support a caregiver who's doing that. It's exhausting. The caregiver is up all night, when, helping the person turn over in bed or whatever it is so that they don't get a good sleep themselves. And they do that day in and day out and month in and month out. And that's exhausting. But respite care is difficult too. David's family was having a family reunion in Wisconsin, and he wasn't going to go. And finally, we forced him to go. And he was away for 3 or 4 days. But we discovered it took 4 people to do what he did every day. And that is one of the difficulties of helping provide respite care, but figuring out ways for the caregiver to have a little bit of time for themselves and just even time to go for a walk or go to the store by themselves or something is really huge. But I think one of the other things that is important for people to know is that people, when they start out, they have a diagnosis and it's like, oh, you have ALS. Well, you're going to die from it. There's nothing you can do. That's not really true. There's a lot of things that you can do. You are going to die from it, but there's a lot of ways that you can make the person's life better, both medical and emotional and so on. That can be excellent interventions over the course of the journey that they have. So that's pretty much what I had for you for today. Does anybody have questions that we can?
Corey, I have a question for you, my dear. This is Candace. If you were to say one thing to folks who are listening about what you think Caroline would like everybody to know if she had 5 minutes to share something with everyone, what do you think it might be?
I think that the thing that she would want people to know is what I was talking about the communications. She did not, her intellectual capability was not diminished by this. And it was very difficult for people to talk with her and be with her because it's hard to communicate with someone who can't communicate back. And that was for her one of the most difficult things that she would want people to know, be conscious of, and try and make sure that they don't do those things.
Mm-hmm. That they're more sensitive to the communication piece. And did she appreciate when people were honest with her, and to say something like, maybe a friend came to visit her, if somebody said, Caroline, I'm really struggling with trying to make sure that I am sensitive to this communication piece, and I may make mistakes, but I'm trying my best. So bear with me and be patient and let me know if I'm not doing a very good job, or something like that. Did she appreciate that kind of honesty from her friends and family?
Oh, I think she did. And she once she had the eye gaze system, she was able to communicate, but it was just quite slow because typing by moving your head like this around to type on the computer is quite slow. But I think she really did appreciate people who understood what it was that was going on with her on that.
Yeah, and I'll ask Rita and Becky this too, but you know, in this day and age, we really rely a lot on technology, but at the same time, we have many areas of the state with no broadband coverage and no internet access, or at least to the degree that we'd like. So do you have other suggestions for devices that you might recommend to other people? For instance, a word board or something a little more not so
Well, we did
connected to technology.
we did use the word board a little bit. That it helped a bit when, you know, when she was away from the eye gaze system. And we did a lot of the, you know, look here if it's yes, look here if it's no, kind of thing. It's rather hard to rephrase every question you want as a yes, no question. But that also was helpful. The eye gaze system, she died in 2005, so the technology I'm sure is significantly improved since then. But it was a slow process, and she had to go through quite a bit of fussing with Medicare about it because they wouldn't want to pay for the communication device because it could connect to the internet and she could get email on it. It was like, well, yeah, but she also can't, you know, tell people that she's hungry or hot or cold or whatever if she doesn't have something like this. You know, it's essential for her health and so on. And that was a big fuss with Medicare back then. Hopefully it's better now.
Did David and you and other family members have difficulty accessing resources at all? And professional resources to augment your own services?
Not really. Mercifully, Caroline had financial resources, which a lot of ALS patients don't have. So we were able to get her a van, for instance. We were able to, you know, remodel the bathroom, all of those kinds of things that were necessary. The resources for the clinic resources were, you know, a challenge. Having to travel to Massachusetts. But mostly she was able to get the resources that she needed.
And Lori just put a comment in chat that said, thank goodness that availability of resources and technology in regard to technology and the quality thereof have improved greatly over the years since Caroline was using them.
Yeah, well, just think how much the internet has changed in the last 15 years.
Right,
So.
for sure. Yeah. We rely on it a lot, don't we? As families start out, Corey, what would you recommend as a family member, and what do you think David might want you to share about what families need to know or be aware of or take in, you know, earlier on in the illness to be both emotionally supportive, both to themselves and their loved one?
Sort of hard to know. I mean, there's a huge educational thing in terms of kind of learning about the disease and until Caroline was diagnosed, I had never known anybody with ALS. So, and neither had anybody in the family. So there was a huge time when we were just kind of learning about the disease, the progression, and so on. Caroline had strong opinions about a lot of things, and she had strong opinions about what kind of interventions she wanted. She did have a feeding tube for quite a long time. She wanted to be on a ventilator if it came to that. It never did come to that. And I think that probably would have been a bad decision to be on the ventilator. But she died before it became necessary. But it was really education, learning about the disease that was kind of consumed us all for several months well after the diagnosis.
Yeah. Paul asked a question about what resources do you think were the most helpful as you look back on the years that Caroline was dealing with this illness? What resources did she, David, you, others find the most helpful?
I think she found the support group very, very helpful. There were some people who felt that going to a support group early on was too scary, that they would see people who were in a wheelchair or people who couldn't communicate or whatever. But Caroline felt it was very helpful to see everybody and talk with people and share the experiences that they were going through. And I think that was probably the resource that she felt was most helpful to her.
Hearing from other families and other individuals who are living with the disease.
That's right.
Firsthand, yeah. Caroline was an attorney, wasn't she?
She was. And
yeah.
That's one of the reasons why she was used to, arguing in court and so on. And when people would talk to her as if she were somehow not able to understand, it made her crazy.
I bet. Yeah. An opportunity for education, right? For other people.
It is.
Yeah.
It is.
Yeah. Thank you so much, Corey. We'll just let you take a break and take a deep breath, and we'll come back with more questions as we go along. Does anybody have one more question for Corey before we segue to our next panel member? All right. So let me go to Rebecca Wyke. Thank you, Corey. Stay with us. Becky, lovely to see you. Yeah, thank you for being with us. I'm sure the university hates to spare you even for a half an hour, but thank you. I remember fondly your family and you and your children and those years that I had the privilege of working with you. Thank you so much. If you have some comments to make right at the get-go, please feel free to do that. Otherwise, we'll just go back and forth with questions and answers. Would you like to just introduce yourself a little bit more and your family's circumstances?
Sure. Well, good morning, everybody. And thank you, Candy, for initiating a little reunion with Rita. It's been many years since I've had an opportunity to see two wonderful women who were very important in the lives of my family. It has been 2 decades since I lost my husband to ALS. And I've had to do a little bit of reaching back. Candy, thank you for your suggested questions, because that helped prompt me. And listening to Lori brought a lot back, and listening to Corey brought a lot back. But I've probably forgotten more than I will remember about the experience. But at the time, we were a young family. We had 3 children who were all in grade school when he was first diagnosed. And like many ALS patients, he went through several misdiagnoses in a 6-month period. And I suspect the progression of his illness in those first 6 months was more noticeable to Rita than it was to me, because when he would come home, he would sort of sit down. He would always carefully, and I wasn't really realizing it, carefully choose as it progressed, a hard chair that was easier to stand up from than soft furniture. And so I wasn't seeing what was happening when he was running around the state house and tripping over things, except what he would share with me. But then, ALS became very prominent in our lives for the next 3 years. And we had to figure out a lot on our own, as Corey indicated, with her sister, really just a few years behind Joe in her progression. There was no clinic in Maine. We were going to Vermont, to Burlington, I think it was once a month. And just that distance, especially as the illness progressed, was quite difficult. So thank you for your advocacy, Corey, and in helping to bring a clinic to Maine. I think that's really important for families. But Candace, I think I'm going to come back to you, and you can send me where you want me to go with your questions.
This is wide open, but I guess I remember fondly many, many, many anecdotes, many stories, many conversations. And Becky, when you think back on it, you had 3 school-aged children. And because we've already stated that illnesses like ALS and most other illnesses become family illnesses in many different ways, how did, once you had a diagnosis of ALS, were you with Joe when the diagnosis came through, the definitive diagnosis? And if so, how did you share that with your children?
So we didn't share it right away. And I will say it was actually, I was at a conference and he was heading to the clinic in Vermont for some tests. And I just suddenly knew I had to be there. And it was one of those situations where, the flights were all delayed. So I think I got into Portland about 4 a.m. And he thankfully drove us to Vermont because he'd had a good night's sleep. But I honestly didn't really understand what was happening. The neurologist that he had seen called it motor neuron disease, and of course I had never heard of motor neuron disease. So I looked it up, and, kind of having to learn about it on your own without having a healthcare professional explain to you what it was. And in those days, we would talk to each other by phone, probably a dozen times a day, just call each other up to share the latest gossip in the state house or check on who had the least busy schedule to go get the kids. And I remember calling him and saying, this does not sound good. And he said, no, it doesn't. But, we'll go see the specialist. So we did. He had a day of tests, and then the diagnosis came, and we were both sitting there. And this wonderful doctor who specialized in neurological illnesses told us what the diagnosis was. And that was the first honesty, I think, that I felt. Perhaps Joe had gotten a cleaner definition. I think he was a little bit more prepared. And I immediately started talking about, okay, well, no offense, but I want a second opinion. And who would you recommend as a specialist where we could get a second opinion? And he had to explain to me that he was the second opinion. And so it was a very difficult drive back. At some point, I think he became more of a wreck than I was, so I had to drive on no sleep. Though all the way back to Maine, we did not stay over as we had planned because he really just wanted to get back to the family.
Yeah.
And there is a grieving process that you go through, and it's at the front end of this illness when you really understand what it means. And he had a difficult grieving process. He, on the one hand, he's not a public figure. He wasn't elected by the populace at that point. He was the clerk of the House. But by the same token, he was, a very noticeable person in the State House. And I can remember we took our family vacation where we were at the lake for a week or two. And before we had left, and by the way, I was not allowed to tell anybody what he was going through. And so I was being respectful of that. So I had not told any of my close friends. And we're on vacation, and I had no idea he had sent a letter to every member of the House and every member of the Senate explaining his diagnosis, and thought that would somehow stay private among 151 people.
Yeah.
And of course it didn't, and it was in the newspaper. And a close friend of his from high school who happened to be in Maine with his family visiting that weekend finds out this way. So we had a little bit of explaining to do. The kids were, I think, still somewhat oblivious to what was happening, but he did get to a point of acceptance, and that was a really important milestone of accepting that this is what's going to happen. But you had to get through those stages. And once we were there, I think the smartest thing we did as parents was to bring you, Candace, and ultimately ended up being his personal physician, Laurel Coleman, who was active in the hospice movement, to the house for dinner to meet the kids. And we'd explain to the children, what was happening. We felt honesty was the best approach because they see things and they hear things. And we felt it was important to be truthful to them, that no, everything isn't going to be okay. It's going to be different. And I remember we left them alone with you and Laurel to give the kids a chance to ask any questions they might have that they didn't want to ask of mom and dad. And I think that was a really important thing that we did. It took us a little while to get there, but over the years that have intervened, I've had friends who've had, it might be a cyst in their breast or some other issue, and not wanting to talk to the kids and saying, they're not going to believe you the next time if they find out you weren't honest about what was happening with you this time. And so I think it's advice that has served me well, and that I've tried to share with others who are going through not the same experience, but their own experiences.
Thank you, Becky. I remember that as clear as it was yesterday, my dear. And thus began the journey or continued the journey for you and your children. And I still think about all of you today. If Joe was sitting right here and was with you on this Zoom call, what do you think he would want everybody to know, both from obviously a point of view of someone living with ALS, but also tangentially for his family? And, I'm sure some of the things, I remember when Joe said to me, even though we may have more financial resources than other people, we still can't find someone who really is not, knowledgeable about all of things that we'd like to have people be knowledgeable about around this disease. I'm probably paraphrasing a little bit, but so what do you think Joe would say, Becky?
Oh, well, he would have a lot to say. If he could speak again. I think he had the limb on set, so he was able to keep his voice for a while. But when that started to go, that was the hardest thing for him. I think of all the little deaths along the way of things you have to give up or can't do anymore, I think not being able to speak was the hardest one. And he was very popular with folks. He had many, many friends, very few detractors. And I never saw the loss of, not the loss of respect, but I don't think anyone ever dared to speak down to him because he would have run him down with his wheelchair. So that did not happen. The intellect was there. He worked right up until a month before he died. So they created a role for him as clerk emeritus in the speaker's office, and he continued to go to work on a daily basis. And although it was exhausting, I think it gave his life purpose and meaning. And it also educated all those people around him. And he was hard to say no to. And so when there was some legislation on hospice, he wanted to be the spokesperson for that. And help get that through. And so I don't think he experienced that as much. I do think the communication thing is very important. I shared my experience with not having frank communication with healthcare providers, or some healthcare providers who don't want to deliver the bad news, but it's part of the job, and you got to do it, and you got to do it with some compassion. But I think what Joe would say, and it's very easy to speak for someone, especially as their spouse, but I knew it was really important to him that even if he was having trouble forming the words, that they had to be coming from him, that I not speak as if he was not there. And I think Rita and I will both remember times when he made his presence known if we were too quick to answer for him. And then I think his other message would be, he always wanted to be a history teacher, but he was afraid he couldn't raise a family on a teacher's salary. So he studied accounting and then never really practiced it because he was elected to the legislature at a very young age, and then that became his career. But he was always a teacher for the folks around him. And one of the things that I think he really taught the people in his life, particularly after he was ill, was to live your life, every minute of it. Those moments are really precious. And he did, through his work, through going to all the kids' sporting events, to taking family trips, to still going to a conference now and then, no matter how many people it took to get him there. And, the advocacy work that he did, that I think Rita's going to talk a little bit more about in terms of, we were having difficulty figuring out how to navigate this illness. So, me and Rita started a support group, and all of a sudden you had a bunch of people figuring it out together, which really made a world of difference.
Yeah.
So I think, the message of do your grieving, get through it, and then embrace what you have left of life and live it as fully as you can.
Yeah, thank you, Becky. I remember fondly how adamant Joe was about not going to the hospital throughout his illness, that he wanted to stay at home. Do you remember that discussion? I'm sure
it would be hard to forget. He, even his power of attorney, he wouldn't name me as his power of attorney until I swore that I would not do any life extending measures. He had, I think it was like a gold bracelet or something where, which kind of tells emergency workers, I don't want to go to the hospital. And, there was, so he was very concerned about that. We did ultimately agree to do a feeding tube because I had done some research on it, and I said, look, this doesn't prolong life so much as it prolongs quality of life, because unlike some other illnesses, you're going to feel the hunger. You basically will starve to death if you can't use your throat muscles. And so I think this one makes sense. And so he also looked at the materials and he agreed to that one. But then there was the time I was at work, my sister, so we had this whole family network. So yes, Rita would pick him up in his van, drive him to work, and kind of be responsible for him when he was there. But at night and in between, it was my brother-in-law, my sister-in-law, my sister, and another sister-in-law who literally moved home, took a job from Connecticut, took a job in Augusta, changed her whole life, and came to live with us to provide that extra support. And it really did take all of us at the end to do anything, simply transition him from his wheelchair to his bed. And I've kind of lost my train of thought of where I was going, but I do really think those, what was the question?
You just go where you want to go, my dear.
I have no idea.
Yeah.
But we couldn't have done the things that we did without that network. And so as you move through your life, cultivate family and friends, because you will need them along the way.
Yeah. And as you say that, and I think back over those years with your family, I also think of all the families that don't have that breadth of support from either family or other support people. And so that does make a huge difference, even though it's difficult at some level for everybody who's keenly involved with this. Could I pick up the quality of life piece and ask you another question? I remember fondly, and I mentioned this to you a couple weeks ago when we were talking about putting this webinar on, the Boston Globe reporter who came and shadowed your family. Remember her? And we were at the State House, I remember, and Joe was working with the Speaker of the House at the time, Mike Saxel, and they were having a conversation, and the Boston Globe reporter was sitting there just, chit-chatting with me while we were waiting for Joe. And she leaned over and whispered to me, and she said, with this interesting expression on her face, she goes, "Tell me about the quality of life, quality of Joe's life. It must not be very good, is it?" And I know my limitations, Becky. So when she said that to me, I wanted Joe to answer that question. And Joe, in his own inimitable way, was sitting over there, and he had one ear on us and the other ear and eyes on Mike Saxel. But he could hear everything. And he whipped his wheelchair around and looked at me. And I said to her, I think Joe needs to take this question. "Oh, no, she said. And I just motioned for Joe to come over, and I knew he was going to anyway. So he rolled his wheelchair over, and he just looked at me. He didn't say anything, and he was still verbal at that time. And I said, "Joe, I think this lovely lady has a very interesting question for you." And I mean, she was horrified that I would ask Joe to answer that question, and it really belonged to Joe. It didn't belong to me. And so I said, "It's all right, my dear. It's all right. Joe appreciates honesty. And I'm glad you asked the question." And so I said, "Just ask Joe that question." And Joe had said, "Oh, Candace, that's all right. You can answer anything for me." And then I go, "No, not this one, Joe. This is yours." And so he looked at her and didn't say anything for a second. And then he said, "My quality of life is wonderful." And I know about that briefly. And you said, at times, it might not have seemed that way, and especially when early on in the illness. But then he went on to tell her why he said that and what that meant to him and his family, and because of his family. So do you want to just speak to that a little bit?
Well, I think it's essentially what I've been saying, is that he still filled his life with meaningful work, with family, with friends. He tried to do the things he did before. It meant a lot of us scurrying around to make sure that could happen for him. But it was important. And, I think his sister and I used to joke, there is nothing we can say, right? He is dying and beloved, and we do his bidding. and that was it. So he was definitely in charge. But I think, as exhausting as it was, and it really is exhausting to be a caretaker, even if you have as much help as we had. It was absolutely physically and mentally exhausting. But I can't imagine how dismal that 3 years would have been if he had not chosen to live his life in every minute of it and make sure that we all did as well. And
Because
yeah, so it's like anything, it's like anybody else, whatever your circumstances are, you choose to live a purposeful life and you're going to be happier with it, no matter what your limitations.
Yeah, it's infectious, isn't it? And people who are ill, there's a lot of life lessons there if we're paying attention to them, aren't there? Yeah, yeah. What do you think your children took away and what they've shared with you in latter years about that experience? What were the life lessons that you think they'll walk away with for the rest of their life?
You know, I will tell you that at least one, although the others say they did too, and I just didn't know about it, sort of struggled a little bit in later years with, losing their father at a young age. And a little bit of abandonment issues. And the eldest one did get some counseling for that. And it was just trying to understand that those losses early in life, no matter how loving the family, no matter how open, have a real impact. And that other, even lesser losses sort of bring up that first one. So making sure that you have your eyes out for that and helping them to sort of understand how to deal with loss. And I'm not sure why this story is coming up, but my middle child had a very, very close friend at that time. And mother was a little scattered, but she came over one night. Here I have a husband with ALS and 3 kids, and she came to pick up her son one night and said, she was beside herself because the puppy that they had gotten had been hit by a car and was killed. And so she was very upset. She's explaining this to me, whose husband is dying, and talking about she's not going to tell the children that the puppy has died. She's going to tell them that it went to live with the vet. And that story stuck with me because I do think learning death is such a natural part of life that you really do need to learn about it when you're young and understand the consequences of it and what that means. And no matter how hard it has been to lose the different pets that we've had as a family, when their time comes, it's an important way to help children learn to move on and to understand it. And in our house, we remember Joe all the time still. Some of the many memorabilias and pictures that were all over the place have come down a little bit over the years, but there are still some key ones up around the house. And when we get together as an extended family, we often remember him and things he said or did that make us laugh. And that's how you keep someone with you. But the children, I think each had their moments as they grew up where this was hard, but I think they always remembered their father as getting out there and living their lives. And they very much are like that as adults now.
Lovely to share. Thank you, Becky. And I will come back to you. Are you going to be with us until noontime? Will you be able to be?
I will.
Okay, great. I'll go to Rita to pick up about the work aspect of this and her friendship with Joe. And then I'm going to come back to all 3 of you and we'll ask a few more questions and have a bit more of a conversation. And I think though, before I go to Rita, John Harris had a question. John, do you want to ask that right now?
I'll unmute. Yes, Becky. you had support from Candace, of course, but was he directly enrolled in the hospice program? It looks as if he really lived life right up to the end. But
He did. There came a point in time when he became eligible for hospice. He was a huge supporter of hospice. Even before he became ill, his mother had had hospice care. She died of ovarian cancer. And he was so excited to get a hospice volunteer to come and read to him. And I actually got kicked out of the room. When she would come, he wanted me out of there. And I'm like, where am I going? What am I going to do? But it didn't matter. He had his special hospice time, and they had a book. Carolyn Kennedy's book had just come out. It was the sequel to her father's book. And they had their little reading sessions when the hospice worker came. We had other care that was there regularly on a daily basis, someone who came in Monday through Fridays who helped to get him up and get him bathed. That was there for maybe an hour a day, but that was not hospice. But the hospice volunteers were there. That was really important for him to have that time, so much so that he wanted it all to himself.
thank you.
That's a great story. Underscores the value of hospice volunteers for sure. Yeah. John, my role with Becky and Joe's family was more of an outside, just a friend and consultant, and to be available whenever they needed, something additional in the way of input. So I had the privilege and pleasure of being that person. Thank you, Becky. Stay with us, please, my dear. Hi, Rita.
Hi, Candace. And I too have to thank you for getting me a chance to see Becky and Corey. Both of them have been a big part of my life too.
Absolutely.
Hi, everyone.
It's so nice to see you together, all of you. It brings back a lot of memories. And as I mentioned before, Rita was Joe's seatmate in the legislature, and then she was his assistant in the clerk's office, and many, many, many more titles we could bestow upon Rita in regard to what she did for Joe and befriending Joe's family and extended family. So right now I'll just, Rita, if you'd like to make a few introductory comments, and then we'll just continue with the conversation, my dear.
Sure, Candace. I think I'll just go ahead with what you had asked for, and that was how I got to know Joe and the whole process. I knew Joe from the time he was about 15 years old, I guess. He went to the same church that I did, and so I would see him come in with his dad and all. And but I really didn't know Joe till he was in college, and I was the advisor for the Catholic Youth Organization, so at the local level. And we used to take the kids off for a weekend in Portland and do some big things, and that's where I got to meet Becky. She was a friend of his, and she and he were both on the state level of the Catholic Youth Organization, making big decisions and so forth. And I was thoroughly impressed with all he knew and how he handled himself in meetings and so forth. And in 1982, his dad and I both ran for the Maine legislature. And unfortunately, his dad and I, we were both elected, but his dad died about 5 months into his term.
Oh, wow.
And so that was, kind of tragic. And Joe being in college, and I swear, I used to always say, I think he, did his teething on a Robert Rules of Order, because he knew parliamentary procedure inside and out. And I'm sure there were times when he made John Martin sit back and take notice that there was somebody there who was going to challenge some things and make sure, things were happening the way he thought they should happen as well. And so let's see, Joe did run for the legislature, and he won big margin, huge margin. And then he and I both continued to run 5 more terms after that. I wasn't going to run that 5th term, but he kept insisting that I run because he wanted me there for that term. So, okay, I'll do one more term, Joe, and that's it. Well, no more than got into that term, and the clerk of the house retired. So Joe decided, you know, he had to move up. And that really was a fantastic place for him. He had such a feeling for the whole legislature, the legislative process, the procedures and everything else that it was his home. Yeah. And so I finished my term back here while he was up there leading us off. And he did a fantastic job. And both parties really respected him. It was just amazing. I mean, he had just, you know, been the whip, which is the leader of the Democrats at the time. And so he had to be very partisan in that position. But it was just amazing how he could just reach out and touch most of the people in the other party. You say most because we can see that there are times when you have to
clarify that, right?
But I'll tell you, it would be some different in Washington today if Joe was around, because he knew how to make people work together and not to remain so partisan. So anyway, it was I completed that term, and then I realized, oh my goodness, you know, I haven't even done anything about my retirement, because a few years of a retirement that I'd had working for physicians for 10 years. I had pulled out. That was, you know, it was insignificant. So I pulled it out and decided, you know, I probably would not go back to that anyway. So I decided that I would run, I would go to talk to Joe about having a position in his office. And that way the salary would be a little higher, and my legislative pay certainly wasn't going to give me more than a couple $100 a month, if that. And so anyway, I decided I'd work for him, and I did. And it was in 1999, it was May, as I recall, and we were getting close to the end of the session, but yeah, he'd be going up the stairs and would, you know, catch his toe on the stair and so forth. And then I caught wind, well, he actually told me, he said, you know, Rita, I was really embarrassed. I fell down, he says, and the speaker had to pick me up because I couldn't get myself up. Well, having worked for physicians for years, and I did work right in an office adjacent to his doctor, and I knew his doctor quite well, and I kept nagging him, Joe, you've got to call Dr. Weaver. You've just got to call Dr. Weaver. You know, at least tell him what's going on. No, I got to wait till the end of the session. So one day he came strolling through the office, and we were all gathered around, and he would just come and chat with us and keep everybody's spirits up and so forth. And that day was just more than I could take. So I picked up the phone, and of course, Joe and I had a great sense of humor, to the point that, I mean, even in the house, when I would try to correct him on something or try to, you know, tell him, you know, don't do this. He was only a year older than my oldest son. So I kind of treated him like a mother. And there were times when he would just say, Mother Melendi, okay now. And they would just all laugh, you know, and so forth. So it became Mother Melendi. Well, Mother Melendi decided the humor was going to go big that day, because she picked up the phone when Joe was in there talking to everybody, and they're chatting and laughing. And I called Dr. Weaver. And I says, Dr. Weaver, I think that you need to talk to Joe Mayo, and I tell you what my concerns are. And I told him what my concerns were and so forth. And then I just picked up the phone. I said, hey, Joe, here's the phone. Dr. Weaver wants to talk to you. Well, he's going to play my game. So he picks up the phone. He says, hello, Dr. Weaver. And boom, Dr. Weaver was on the other line. And then I heard him say, okay, I'll see you on Friday. Well, that was still in May, and we still had a few more weeks till the end of the session. So anyway, that's where he and Becky and Vermont took over. At least we got his foot in the door. And then, as I recall, and Becky, I know you said that, you know, he had a chance to write to everybody. Unfortunately, the letters that he wrote to the people in the legislature, to his staff and the people in the legislature, had not yet reached us. And the newspaper picked up the story, and he was devastated to learn that everybody had learned from the press rather than his own letter that came to us the next day. And that was really, really tough for him as well as for us. And so anyway, and yes, the press, you may have seen you know, the Boston Globe there, but I'll tell you, it seemed like every day there was somebody else from another newspaper wanting to interview him. And God love him. He was just right there for them all the time. He would, you know, in fact, I think because of what was happening and the way it happened, I always would tell people Joe Mayo was the face of ALS in Maine, because most of us knew ALS, yeah, Lou Gehrig, right? Okay, well, we really didn't. And there were only a handful of people, maybe 4 or 5 people to my knowledge that had, not even that, it was 3 people that we knew that had ALS. And so it was really fitting that that Joe not only let the press, I mean, he was just so open with the press. I used to hurt for all the questions that they would ask him, but I knew he wanted the people to know what ALS really was all about. And there were times when I would have all I could do to contain myself. And so I would just kind of stroll off a little bit, go down the hall, catch my breath and so forth and come back. Well, lo and behold, and the press started following me down. They wanted to know some more things. Well, what about this and what about that? I said, ask him. You've asked him everything else. You know, there's nothing that he will keep from you. And so, you know, that's the way it was. And so when I say the face of ALS is that Joe, for years, because he ran in leadership, he would travel to every county, every district in the state. So everybody knew him. And so anything they learned, they shared with their own community, you know, people in their community that want to know, okay, what's going on in the legislature? What about your clerk and so forth? So anyway, that summer, yeah, Becky spoke how the family went on vacations and so forth, and were sharing and getting to know about the disease, how they're going to deal with it and so forth. Well, I was just waiting for the session to start and see how things were, because I hadn't seen him for a while. So we came back, and it was November that we started meeting, I believe. I can't remember. I mean, time is going on. He was having more difficulty talking. I think, Becky, maybe you can correct me, but wasn't it maybe that fall that that he then started having a little bit of difficulty with his hand movement and so forth? He still had the speech, but the hand movements were getting slower and so forth. And there was just so much paper and so many things that he was going to have to do, you know, that I actually had gone right into his office when this session had started again. And I was shuffling the papers for him, and also going right down to the podium with him to be able to help him in any way I could to maneuver the papers and so forth while he called, you know, session to order and so forth. And then one day he couldn't lift his hand up to be able to call the meeting to order, the legislature to order. So I simply picked up his hand, and I guess it was about that time that he decided maybe he was going to have to leave as clerk of the House. And I just dreaded that day, because I knew that was, his family was number one, his wife and kids. There was nothing that could go, you know, higher than that, than God himself. But the legislature was just, that was his heart and soul in terms of daily being able to live his life to the fullest. So anyway, it was just fantastic. Someone made the motion that he would become clerk emeritus. And the clerk emeritus, yeah, people say, oh yeah, what a lovely title. This was no title for Joe Mayo. This was a job, a major job. I mean, the speaker's office, they set us up with an office that was kind of a corner office, so that Joe's wheelchair would fit in and my chair would fit in. And Joe and I would I would hand him every piece of legislation that came through. He would look at the title, and some of them he'd nod that he was going to want me to put aside. And those were the ones that he was going to have to go through. And so I would run my finger down where he was interested in wanting to read about it. And then he'd let me know. And I would take these things that I leveled for him so that he could read everything. And he really, the speaker depended on him totally. And so when there were pieces of legislation that had troublesome spots, I would then call in the lawyer and together we would be able to discuss what was going on. And Joe could still talk some, but later when it was even more difficult for him to talk, because he did work up till 3 or 4 weeks before he died. And so it was one of those things that we could still communicate, because I knew the legislative language and I knew the concerns that he had. It was easy for the lawyer and I to be able to converse on things. And Joe, is that what you want? And, you know, and he was still in charge, always the one to make the decisions of the things. And so, yeah, for the ability that I had in being able to help him be all that he could be, I'll tell you, it was a gift that he gave me that I still cherish.
Safe to say you will forever, Rita.
Oh yeah. Oh yeah.
Yeah, yeah. So following right up on that, what was the one thing that, I mean, of many, 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 many things that you're sure Joe would want you to pass along to someone else? I mean, you just passed along this beautiful story, but if you had 5 minutes to spend with somebody, from Joe can't speak for himself, and it's always important, I think, to pull these little nuggets out that, you know, you would want someone. It's like life after death. You pass a voice along when that voice can't pass itself along. What do you think Joe himself would want this group of people to know? You were associated with him in a work setting and a friendship setting. What about support networks would Joe like to offer someone else?
Wow, support networks. I'll tell you, that was one of the first things that Joe wanted to do. He and Becky had gone to a meeting, I believe, in New Hampshire, a support group type meeting. And he came back talking about how important it was to be able to reach out and touch other people that were dealing with the same thing that he was dealing with. And so they opened up their home, and we had our first, I would say, half a dozen meetings at their house, you know, had the coffee and the sweets and so forth. And then we could see that it was going to be difficult for people to get in. So Joe decided, I'm going to have it at the State House. I mean, the State House is their house, and it's also going to be more convenient for me, but it's central to the state, more central to the state. So it was easier for people from all over, from Bangor and northern Maine to come down, and people from Portland and so forth. So it was an ideal place. And one of the things that it did, it opened up the eyes of other legislators and a lot of people, you know, in government, to see that these people are, yes, they have their own voice for a long time, and they're also able to do a lot. Just because the muscles are giving away, it doesn't mean that they should be put on a shelf someplace. And I'll tell you, the people that came to our support groups, you know, Caroline and so many of them, it was just amazing what they were able to share and help other patients. And I think that was his big thing, being able to help the others. And I remember he used to go, I'd say, you know, what are we going to talk about today? What are, you know, things that we think that they should learn? And he'd say, I just had my feeding tube. Let me be exhibit A. And so sure enough, would bare his belly and show them exhibit A, and that it didn't hurt. And look, he's able to take his medication this way now, and so forth. And I think it was really good for a lot of them, as it was for him. There were some of them that had other things that they could share with him. And so the importance of not giving up on people, but helping all be as much as they can be.
Yeah, the whole honesty and transparency piece too, it sounds like. Those are my words, not yours, and Becky's, but I found that to be very true with Joe. He was just right there, very forthcoming, maybe not always, but certainly during the support groups he was. And I always really respected that. I remember the feeding tube support group meeting actually very, very vividly. Yeah, and the discussion prior to it. Yeah, for sure, for sure. So when you were with Joe every day in the State House, Rita, and in his office, and his colleagues would be coming in and out all the time, and Joe's illness was progressing, I think it would be very insightful to share a bit about what you saw as the struggles of people, both emotional struggles, psychological struggles, maybe even a little bit of resistance to come by a lot, eventually didn't come by a lot. I remember clearly that you and I had these conversations. I think it would be very interesting to share, and Becky too, I'd like to have Becky weigh in on this, that what did you see in the State House environment, Rita, and what Becky and Caroline saw with their, Becky with her husband and Caroline with her sister, the challenges that people who may have been very close to, in your case, Joe and Caroline, but then all of a sudden didn't stop by anymore. What struggles do you think you saw with folks?
Well, I think the thing in the beginning is everybody was so accustomed to Joe serving them. I mean, he would go to the end of the earth to be able to do something and help them to be all that they could be. And so they continued to come in that way. And then as his voice was, leaving him, and it was more difficult to try to converse and so forth, and then I had to fill in a lot of the words that with his okay, and I knew when the okay was there. You could see that some of them were starting to pull back. However, the speaker and those in leadership all really respected him and gave him his all, and they were always right there. But there were a few times I remembered in the halls where I would see somebody come prancing down through with their head in the air and just walking right by, like they wanted to get by just as quick as they could because they didn't want to have to, deal with it. And I recall going to a couple of them and being as short as I am, in order to get their attention, you just yank them down by the necktie. And I said, don't you ever go by him again without at least saying hello, acknowledge him. He is a person, he has a mind, he knows everything that's going on. And so yes, I was pretty tough on some of them, but it hurt too much to see it happening. Right. But it happens in a lot of illnesses too. So we have to, whether it's Alzheimer's or whether it's cancer or whatever, people are so uncomfortable. Yeah. But no, I think in all, it worked out in the long run. And of course he'd put them all at ease. Talk to him, right. At least acknowledge him, and you'll see that it's okay. Ask him,
Right. So that lesson, and probably with Joe's blessing, he wanted to leave as many lessons just by example. Is that a fair statement?
Absolutely.
Yeah. Becky, you saw that all the time too, I imagine.
I didn't. I guess Rita took care of it. I actually, I'll speak about the opposite. People who became very involved, and not anymore. But at the time, there were things I felt it was up to us to figure out and take care of and do, and didn't want to put anybody out. I've totally changed, but that was one of my lessons from this experience, was to allow people to do something for you, even if you don't feel you need it, because it helps them to contribute. And so the examples that I would give is several former legislators who, and some of the lobbyists started to organize and bring food to the House. like all the time. And it was overwhelming at times because there was no way that even with our extended family of caregivers, we could ever get rid of all that food. And so we started bringing food over every night to an elderly neighbor that we had
Nice.
who would bring us vegetables in the summer. And, you know, so that was a lot. And, you know, especially when you've got 3 kids who don't necessarily want to eat that wonderful casserole that someone made. But the woman who was sort of organizing it decided she would ask the kids what they wanted. And then she kind of took it upon herself to organize that. And I'm just going, you know, I can't believe we have all these people thinking that they need to feed us. This went on for years. I mean,
Yeah.
2 years. And then, you know, his friends wanted to raise money for scholarships for our kids. And thankfully, Joe agreed we did not need that. But he wanted them, he said, it's important to let people do what they can do. Not everybody can give their time.
Mhm.
And so a scholarship was raised in his name that still exists today and is there for members of ALS patients' families.
Yeah. Yeah.
In order to help them, you know, fulfill their educational goals, which was very important to him. But there was, against my will at the time, you know, some fundraising that happened among some close friends to get a handicap accessible van for us.
Mhm.
And I had to swallow hard and accept that. But we also donated it to another ALS family after he passed. And I think the lesson that I took from this is, you know, people don't necessarily know what to do or what to say when someone is diagnosed with a terminal illness and the physical changes happen as fast as they do.
Right.
And it's a struggle for them. I think the important lessons were that, first of all, let them help you.
Mhm.
Let them be a part of it and feel engaged with
Yes.
what's happening. That's okay. Even if you don't need it, it's what family and friends do for each other.
Yeah. Yeah. Lovely.
And the other lesson, I think, really was that I did not experience what Rita did, but I do think that anybody who came to our home or was in my presence with him, you know, there is the pilgrimage that comes with people who think, you know, I should see him, you know, one more time before he dies, kind of thing. But he would put them at ease and everybody would be laughing before long and remembering stories. And, you know, I think what he taught us is death is a natural part of life and you need to embrace it. It's not something that shouldn't be talked about. It's something that should be talked about more openly as to what's happening, and take some of the stigma away from those who have been diagnosed with terminal illness.
Yeah. And Joe's efforts to pull the curtain back on dying, the process of dying and death itself was so apparent to me. Yeah. Caroline, we're going to go back to Rita in 2 seconds, but I wanted you to be able to answer or respond to this particular discussion. Becky brought up a lot of issues. Rita's brought up a lot of issues. Did David and Caroline's extended family find that maybe friends or who you thought were friends or close friends didn't stop by as much anymore, struggled with, quote, what to say? Did you experience that as well, my dear?
Yes, I think that was there, but the flip side of it was that there were a lot of other people who were not necessarily that close, who also became much more involved.
Yeah.
So there was a little bit of a back and forth there with some folks who just were so uncomfortable they didn't know what to do.
Right.
And other folks who came in and helped and did things. So
Yeah.
for instance, Caroline had been very involved in establishing ice skating rink in Falmouth. And that group of folks put together several skating events as fundraisers for ALS. And that people were doing things like that that were, you know, very helpful, not necessarily specifically for Caroline, but for supporting ALS resources and so on in Maine. So
Yeah.
people were definitely coming in to help.
Yeah.
But there were plenty of others who were just, they couldn't deal with it. And
Yeah, sure. Sometimes it's those that you would least expect are the ones that really show up the most and show up in different ways by doing things. Yeah, it's hard to anticipate. And to Becky's point about willingly accepting that kind of generosity on the part of people who want to do something, and everybody doesn't need to do the same thing, but everybody or many people want to do something. So graciously accepting that. Yeah. So we're going to go back to Rita a minute, and then we're going to leave the last 15 minutes for questions from the audience. There's quite a few questions in the chat room. So, but Rita, and thank you, Corey and Becky, for your comments just now. Rita, you know, what do you think about today, these many years later, as when you had this opportunity today and you've shared so much wonderful anecdotal information about your time with Joe? If you were to leave this group today with one thought that you just had to share with them about what you learned from Joe, what would, I know it's many things, but one of the things that is your takeaway for this conversation, what would it be?
Wow, there are so many things. His humor obviously was a great big thing that helped everybody. And I remember when somebody tried to call 911 and he, absolutely no, he was choking on food. And so then I just looked because it was a dinner meeting amongst some of his colleagues from his freshman class. And I said, well, Joe, now, I mean, we bet you cleared up now. Tell me, what do you want us to do if this were to happen again? And in his humorous thing, the word toe tag came out. One of the things Angus King, kind of put it all together when he said that Joe's humor was one of those things that could, diffuse any difficult moments. I mean, he could diffuse things and then come back to the tough subjects at hand. And so, but that was one of the things. But in terms of what I would thank Joe for, and so many people would thank him for, is how he taught them how to die with grace and dignity, even in the face of adversity. It was just one of those things that it just reeked from him. Yeah, he was an inspiration to all of us, and we have that to thank him for. I mean, big time.
Yeah. And his colleagues in the legislature too, do you think many of them were able to take all that in? Some of them maybe not, and still not, but
I think amazing how many were able to take that in. He was just so open, and I think that it behooves us not to listen to a patient and not to see what they're doing to continue. He never worried about himself. It was always the other person. It was always, what can I do for the next person? And if we can carry that on with us as we, get to, some of us will have a little bit of warnings that, the end is at hand. But or to be more aware of other people who are going through situations that we know the end is at hand. If we could just take some of the lessons that he taught us, is just fantastic.
So listening itself is key, and being present for people, but allowing the patient to be the teacher. Is that a fair paraphrase?
The teacher and the decision maker.
Yeah.
Always look. That was one of the things, especially with people with ALS. that cannot always verbalize. Just always have your eyes on them and see what their face is telling you, because there were just so many things that I would not have caught if I had not had my eyes on him all the time at the legislature, at least.
Powerful, isn't it? But difficult for many people in our society on a daily basis. We could go on forever here, and I'd love to, but in the interest of everyone's time, I think, and to capture some of the comments and questions in the chat room, I'm going to go right to the chat room, and I'm going to ask, I know Barbara Barnett had some comments and questions. Barbara, you want to share those?
Yes, I'd love to. I'm curious, when someone is diagnosed in the state of Maine and their doctor gives them the diagnosis, does that doctor also provide information about resources, or does the family have to do all the research on their own?
Would you like to direct this to any one person, either the panel or to Lori? Where would you like this to go, Barbara, if you want to specifically direct it?
No, I'm directing it to all three. I was just wondering if anyone had experience with that or know what's going on in the family. And I'll let everyone take it.
Yeah. Thank you. Any one of you panel members can respond to that. But I also, Becky, think of the manual that you and your family and Joe developed for the caregivers. So I'd love to, before we finish today, I would love to have you talk a little bit about that. Corey, did you want to respond to that, my dear? Barbara's question.
Well, I was just gonna say that I'm not sure what the situation is now, and with the clinic and so on, resources may be better. But when Carolyn was diagnosed, she, in addition to being a lawyer, before she went into the law, she had gotten a master's degree in pharmacology, so she was able to, read medical texts and stuff like that. And she basically diagnosed herself before she got an official diagnosis. And she did a ton of research on her own, because at that time, I don't think there was a lot of stuff, but that was 15 years ago. So hopefully things are better now.
So could I extrapolate maybe a little bit from what you just said, and that folks need to do a lot of their own homework to be able to inform themselves, even of questions to ask their providers and their professional resources in their community after they're somewhat.
I think that's the case, but I also think that's the case with all kinds of medical conditions. People really need to be proactive in taking control of their own medical situation, regardless of what kind of situation it is.
Yeah, a good piece of information to leave with folks, for sure. Thank you. Becky, would you like to say something about that manual that you and your family developed?
Sure. I'm not sure it's directly on this point, and I can only hope that things have changed in the last couple decades. But no, we were on our own to research it, and I think that's where the support group came in, because everybody was on their own, and suddenly you weren't anymore. You learned the tricks, like the handle on the toilet. All you needed was a little 6-inch piece of rubber hose, and suddenly that became much more manageable for someone who's having dexterity issues. And to be able to just share information like that became really important for, very basic things for quality of life. But the manual you're referring to, I'm not, it wasn't so much a manual as what we called it was the Book of Me, because it was all about Joe. And it was a 2-inch 3-ring binder that I think I still have, which had, I think Rita had tucked in like an orange paper on the front, all the critical phone numbers for anything that might happen, how to reach various caregivers and medical personnel. And then because there was so much to keep track of, it was tabbed, and we just kept it all in that book. So if he was with Rita for the day at the legislature, the book of me would go with Rita. If he was at home and it was my sister's day to take care of him, she would have it right there at her fingertips if she needed anything. So that if something happened, you know, no one was left scrambling to try to figure out how to find someone's phone number or who to call, or whatever would happen. And it was a way of managing through multiple caregivers what was going on with him.
Mm-hmm. Sharing the information from person to person to person to person. So Joe wouldn't have to, and Joe and the rest of you wouldn't have to try to re-educate every person that came through the door. They could take guidance from Joe and from the family from that book of me, right? Yeah. I always thought that was a great idea. Thank you. Thank you. Do you still have it?
I think I do.
Yeah.
Upstairs in the hallway is Joe's dad's old desk, and it has not really ever been cleaned out. And I think it's in there.
Yeah, a treasure for sure, a treasure. A couple questions came in about finances. For families that don't and might not have the financial support that maybe your family did, Becky, or Caroline's family did, and what resources might be available for those families, if I'm picking up and paraphrasing the questions correctly. Do all of you, and Lori too, if you're still with us, want to offer some insight into that?
So, you know, again, it was a process of figuring things out, and we certainly had families in the support group that did not have means. And ALS, at least for us, was really an illness that's all about durable medical equipment, right? So you have to figure out, if you have insurance, you have to figure out how to navigate that and advocate for yourselves, because they don't really want to see those ALS patients coming because they're expensive. But, you know, he had 2 different wheelchairs. The first one was an absolute mistake, but it allowed him to keep working because it raised you up so he could reach the podium and look like he was standing at the podium. And thankfully, the state changed their insurance provider in the middle of his illness, because then he qualified again, because the next one was the really expensive one where it had to tilt you back and do all the things that help someone who's lost their motor function be more comfortable. But the first thing we did was find someone else who was at a point in their illness progression that could use the old wheelchair. And the same thing, you know, after he passed away, was making sure we passed that on to a family that could use it. The same with the van. There are places who have lots of crutches and canes and walkers. Those seem to be plentiful, but that really expensive equipment, taking good care of it, and then making sure you rehome it.
Yes.
Because the insurance company doesn't want it back, but someone else who doesn't have the benefit of, you know, maybe your medical care policy, it's really important that it go to someone who can use it and that it's the equipment that they need.
Yes.
So I imagine there was a lot of that kind of networking happening 20 years ago. I can only assume it's better. Just listening to Lori at the beginning, I would have loved to have had a resource like Lori back in 1999, but we really had to figure it out for ourselves.
Yeah. Do the other panel members want to weigh in on that? Or Lori, would you like to weigh in on that, my dear?
I would. I want to say a couple of things about what folks should do if they don't have insurance. So first of all, after a number of years of advocacy, I'm hoping that folks know, as of the beginning of this year, people with a diagnosis of ALS no longer have to wait the 5 months for Social Security, disability, and Medicare. So before, similar to like a renal disease, if someone were found eligible for Social Security disability, they could access that and Medicare in 5 months. Now with a diagnosis of ALS, if someone is paid into the Medicare system they are now eligible right away. And by right away, of course, we still need that month or so to clear the paperwork, but that's a big change. If someone hasn't paid into the Medicare system, then main care eligibility should be determined right away, again with an ALS diagnosis. Time is urgent for folks with an ALS diagnosis, and so those services should be pulled together quickly. A lot of the things that the panelists did to start have grown in Maine, but it's because of their advocacy. It's because of people who have come before us. But we now have the ALS Association has an extensive equipment loan closet that does include very nice power wheelchairs that have been given to us. So as Becky was saying, let's repurpose these really great pieces of equipment. So it's not fit to a person. If it happens to be in our equipment loan closet, we will get it to someone while they are being fit for theirs. We don't want people to have to purchase every crutch, every walker, every toilet seat if they could try out some of the things that we have to figure out what works best for them. So that's a little bit about the ALS resources available now. I want to go back to one of the questions in the chat about if someone is being kind of worked up for a potential ALS diagnosis. Somebody asked, are people automatically being given resources? And I would say for the most part, still no. We have people in Maine we have providers in Maine who don't want to give the diagnosis, as some of you suggested.
Yeah.
And so to refer someone to the ALS Association, you're kind of inferring they might have ALS. And so sometimes that conversation doesn't come up. There are people who are not being told about the ALS clinic here in Maine or referred. And I have, we as an association have reached out to each neurologist within the state of Maine just to say, have my information, put people in touch, or better yet, get their permission to allow me to reach out to them, because usually the first conversation is easier if I'm the one to make the call rather than the family having to call me or the person living with ALS has to call me. Right. And yet still, this is why these conversations are important, because the more awareness we bring to what I can do to help, but what resources are available well beyond me and the clinic, that's essential. So no, people are not sharing the resources enough. Providers don't know the resources enough, but these kinds of events help us to build awareness.
Yeah. Thank you very much, Lori. Great information. And sadly, our time is up this morning. It has just been, it's lovely to see all of you. I can't thank you enough for taking time to join us this morning and bringing your experience, your insights, your reflections, your knowledge base, and lessons learned to everyone. I would like to offer, if it's okay with all of you, if folks on the call have questions, if they can either email our office and we'll pass the questions along to all of you, or I don't know if you want them to contact you directly. So if you advise me on that, and the folks are still on the call, let me know how you would like that handled. Would you like them to be funneled through our office and then out to you?
I'd be happy to answer questions from anybody.
Okay, Corey, thank you. Lori? You want
the folks can call me or email me, absolutely.
Okay, great. Becky, Rita?
Same here.
Okay. Rita, do you want?
Actually, if they went through you, because I try not to answer phone numbers that I don't recognize, so chances that I would recognize any number. If you feel threat, I will gladly call them back.
You betcha, will do. I wish we had time for more questions because I'm sure there are many out there. I enjoyed all of you and what you had to say, as always, so much. So thank you, thank you, thank you. And thank you to everyone who took the time out of your busy day to join us this morning. Please stay tuned. We'll be doing a lot more education to promote the work of the ALS Collaborative. So thank you. Have a great day, everyone. Enjoy the nice weather. And if we get some rain, we need it. Bye, Becky. Bye, Rita. Bye, Corey.
Thank you
Lori.
all for what you do for ALS.
Thank you, Candace.
Thank you. Have a good day, everyone.
Thank you.
Thank you.
Thank you.